This is an adult femur. We're looking anteriorly at the proximal end, and this is a right femur. And if we look down the shaft, there we have the distal end. So the distal end articulates with the patella anteriorly and the tibia inferiorly, which makes up the knee. And then up at the proximal end, this portion articulates with the acetabulum of the pelvis and forms the hip. So if we zoom in, so this is the anterior side that we're looking at now. There we go. So features up here. So this nice, or what would have been smooth area of subchondral bone, which we can see anteriorly and posteriorly actually. This is the head of the femur. Looks like a golf ball sort of plonked onto the edge, the top end of the femur. Back to the anterior side. And then this is connected to the rest of the bone by the neck of the femur. So this is the neck from the anterior side and from the posterior side. And just before I forget, so there's a little sort of indentation. It's gone a bit wrong on this one, but you can just about see where there would have been a little, almost like someone's poked it in with a thumb, a little indentation on the head. This is called the fovea capitis, and this is where there's a little short ligament that just attaches the head of the femur into the acetabulum just to hold it in place. So if we stick on the posterior side for a little bit, so we have this feature here on the lateral side of the bone. This is called the greater trochanter, this big sticky up bit. And then sort of almost inside is the trochanteric fossa. So if I turn the bone, so it's sort of from the medial view, you can see the fossa there, just inside the greater trochanter itself. And then inferiorly to that and more medially, we have this projection of bone here. This is the lesser trochanter. So we've got greater trochanter, lesser trochanter, and then there's a ridge or a crest of bone sort of connects the two trochanters. This is called the intratrochanteric crest. Not particularly pronounced on this individual, but sometimes it looks like a really distinct sort of sticky up ridge of bone. Yeah. And then on the anterior side of the bone, so we can see the greater trochanter is still there laterally, and we can just about see, if we turn it a little bit, the lesser trochanter medially and posteriorly. And there's also sort of a little frilly projection of bone which connects these, and this is called the intratrochanteric line when it's on the anterior side. So it's not very pronounced here. There's not much to feel either actually, but it would sort of run from here to here. So it's the intratrochanteric line on the anterior side and the intratrochanteric crest, which joins those trochanters on the posterior side. So move a little bit inferiorly, distally, onto the shaft. There's lots of muscle attachments here, so you can see the bone looks quite rough, and it feels quite rough as well. There's various different muscle attachments. But if we look here on the lateral side of the bone, this bit here, this is really, really rough. This is called the gluteal tuberosity. And on some individuals, this is really sort of pulled out and exaggerated. So it's sometimes referred to as a third trochanter. It doesn't project as much as the other two trochanters, but it sticks out a little bit more. So you might see it referred to as the third trochanter, but it's always the gluteal tuberosity. So that's on the lateral side. And then on the medial side, can you just see that little area of colour change from sort of this region to this region? So there's a thin little rough line that comes down the bone here. This is called the spiral line, and this is also a muscle attachment. And this runs down, if we look further down, still on the posterior side of the shaft. So there's a large ridge of bone which runs down a large portion of the shaft into the sort of more distal area. Again, this individual, it's not particularly pronounced, but this is called the linea aspera. On some individuals, you can like hold it and almost pick up the bone, but you can just see they're sort of projecting slightly, but not very much, another muscle attachment. So if we move down to the posterior, the distal, sorry, end of the bone on the posterior side. So we can see here, we've got it's that nice smooth subchondral bone again. So this is now the distal joint surface. So that subchondral bone sort of starts around the front, goes underneath on both sides, and then sort of back up onto the posterior side. So we have, so this one here, this is the lateral side. So this whole area, so back and sort of side, this is called the lateral condyle. And then on the medial side, this is the medial condyle. And then between them posteriorly is this scooped area. This is the intercondylar fossa. Oh, there, you can see it quite well from that view if we look sort of down the bone. So lateral condyle, medial condyle, intercondylar fossa. And on the posterior side of the bone, just before we get to the sort of the area with the condyles, there's this area, so, and it's beneath the linea aspera as well, this sort of flattened bit of bone on the posterior side. Usually quite a lot of pores in this area because for the blood supply. This is called the popliteal surface. And then on the anterior side, we have an area of cortical bone before we get to that nice smooth subchondral bone. This is the patellar surface. So popliteal surface posteriorly, patellar surface anteriorly. Other features down here. So this is the anterior side now. So this is now the medial condyle. This is the lateral condyle. So just sort of there's cortical bone on the side of each condyle, and on either side, these bits are called the epicondyles. So the medial epicondyle on the medial side, and the lateral epicondyle on the lateral side. And on the lateral side, just down here towards the back, there's usually a little depression or a little groove in this area. And this is the groove for the popliteus muscle. So if you've only got sort of a distal end of the bone and you're not sure how to side it, if you can feel that groove, that will always be on the lateral side. So the groove for the popliteus is lateral, on the lateral epicondyle. If we look back to the medial side, where is it? Probably from this view. So can you see here? So we're just sort of, it's not quite on the epicondyle, we're just sort of getting up onto this ridge here. There's a little sticky up bit of bone, a little tubercle. This is called the adductor tubercle. This is where the adductor muscle attaches. So again, that can help you with siding if you've only got like a tiny portion of the bone, because the adductor tubercle is on the medial side of the bone.